Welcome back, Survive Outdoors. Dan Williams here. Today we're going to be talking about blister prevention. What do you do if you get a blister? How do you take care of it out in the field? And when should you seek medical care for blisters? Even the topic, it reminds me when I was going through my medical training that cardiologists, neurologists, orthopedics, they're all telling those that want to go to their residency that, well, we're the most important profession is the cardiologist, or the GI specialist is the most important. And I start thinking about the body, and some people will say, no, you should be in physical shape first. That's most important if you're going hiking. Another person, you have strength training. You need that. That's more important. You think about it, if you don't have your feet in proper order, you're not walking anywhere very far. So the most important piece of equipment you can get is your shoes. So I'm going to show you a couple pair of shoes that I've been using. These are, and I'm sure everyone's familiar with Keens. I love these shoes. They're waterproof. It's really important to keep your feet dry. That's imperative. And these are, they're called Bear Paw waterproof. They're really inexpensive. I'm sure they're only going to last about a year, but they're very, very comfortable. They're like 50 bucks. So on the Keens, if you wear a shoe for any length of time, and you look at the tread, on my right foot, you'll see the tread is about 1/4 of an inch worn more than the left. And I don't know if you can see that. And that's because I was born with one of my hips that rotates a little bit. And everybody's gait when they walk, their step, their hips, they're all not identical. So when you lay down in bed at night and your legs just relax, look and see if one of your feet kind of roll out to the left a little bit or roll out laterally. That'll tell you something may be going on with your hip, and you may have a higher chance of getting blisters in that foot. You may not be walking consistently at the same gait. So shoes, really important. When you buy a pair of shoes, you need to get those shoes, got leaves and limbs falling. So when you buy a pair of shoes, you want to make sure that they fit properly. One of the things that's really important, put them on, lace them all the way up tight, walk down an incline. If your toes are hitting the front of the boot, bad sign. And you want to make sure your arch is not hurting, because you can get something called plantar fasciitis, and we'll get into that later. So shoes and comfortability, really important. The next is going to be socks. So socks, I usually, when I'm hiking, I wear 2 pair. In the wintertime, sometimes 3. Your first layer of sock can be like a polyester, a nylon, or a wool. They make some very, very thin wool inner lining socks for the summertime. And then you're going to put an outer layer over that, and that's when it can be cotton. You're going to hear a lot of people say no cotton on the outer layer. You can, but if you're going to use cotton for a second layer, then you're going to need to bring an extra pair because it's going to get soaked and it's going to get wet with sweat. The first layer, if you use wool or polyester, it's going to wick the moisture away to that second layer. I personally like using wool on a second layer. My wife loves Merino Wool, Smart Wool socks. So I'm going to show you something about water retention. Here is some compression socks that I would wear when I stood and did surgery for hours. Next is going to be, these are the Merino Wool, and they got their classic little mountain logo on them. And these are just cheapy, run-of-the-mill cotton winter socks. So if I put this polyester nylon in some water and we pull it out, you'll see, if I squeeze it, not that much water is coming out, because it's going to, and that's what we want. That is going to, if you're sweating, it's going to take that to the second layer, and we don't want to touch that right there. There is a beautiful example of poison ivy about 4 inches from this bucket. I looked around here, I didn't see anywhere else, but that is poison ivy, classic. All right, so second layer, the Merino Wool, Put that in the water. And what's also really nice about merino wool and any wool sock is after it gets wet, you can wash these on the trail. You can hook these on the back of your backpack. They are going to dry out within an hour. Whereas this is going to take a long time. So now we're going to do the cotton. And I think you already know what's going to happen. I mean, it's just going to pick up a lot more water. You never want to wear this close to your skin at all. Alright, so you're walking on the trail and you get a blister on your foot. These socks I'm wearing are the Bombas, and they're not bad. You've heard them advertised. Alright, so you're walking on the trail and you're getting a hot spot. A hot spot is an area of skin on your foot that you start feeling pain. And one of the reasons that's going to happen is obviously you got a shoe that's not fitting properly, it's rubbing up against an area, and you're going to tape this hot spot. Ideally, if you're going to get these routinely when you hike, you want to try changing shoes, but you want to tape your feet before you go on the hike. So this is Leukotape, which is it's really the most popular brand, I have to say. You can use duct tape, which I have. You can use kinesiology tape, which is also really helpful, but one of the most common areas to get these blisters is right on the back of your heel here. So I'm going to get the camera closer. I'm going to move this water. Now I see some people, I'm going to put this right here, and you're going to see that a lot of people will put this tape right where they get their blister on the back of their heel because their shoe's rubbing. This is the wrong way to put on a tape for your heel. So your Achilles tendon is here, inserts down here, your shoe is moving up and down like this. I've had people come into urgent care and actually have a blister with the tape on, I might add, right here at the bottom of this blister. So no, we're not going to put it there. The best place and how to apply this Leukotape or kinesiology tape is you're going to start at the base of the foot here. You're going to run it up. You don't want any wrinkles in it. You're going to stretch it, and that's where actually I like the kinesiology tape too. You're going to want to get these wrinkles out. So for the purpose of this demonstration, I'm not going to take a ton of time with it, but ideally you want these out. What you can do, it's almost like a skin repair. You can cut this, put that down, and fold that over, and that will help. So when you put the tape on like this, and your shoe is going up and down, this is not going to roll on you, and you're not going to get that blister. So you want to put the tape vertically on your heel. The other place that's really important is on the ball of your foot. So back in here. So this is kinesiology tape, and I wanted to show you how it works. So I measure first how much I want. I just approximate it. And we're going to get the good Swiss Army knife scissors out here, and we're going to cut this. Now when you put kinesiology tape on, athletic tape, they use these for a lot of muscle injuries. We're going to put this on a knee down the road and show you how to treat knee pain on the trail. But this stretches, and it stretches for a purpose. So you'll start here, and you're going to run that, stretch it mildly. You're going to run that over the ball of your foot. Again, that wrinkle, you want that wrinkle out. So you want to get those wrinkles out of there. And that's how you tape that with kinesiology tape. You can also put these in between your toes. So you see here, I'm getting a little bit of a blister on the side of my toe here. And that is from rubbing on my shoes. So that's a perfect example of an area I may want to tape. I'm not just going to tape it like that. What I would do with that is I would cut this down, and I would want to tape this and roll this around my big toe, and tighten it like that, and then cut it. That way it's going to hold and not roll. So that's kinesiology tape. I like this. This is U Daily Sports Tape. It goes for like 21 bucks, but you get 3 rolls in here. It should last for a long time. And you can use this for muscle strains, knee, shoulder problems. It works really, really well. Leukotape for 1 roll on Amazon is like 7 bucks. That's it. Always good to have this in your pack. Always put your blade back so you don't cut the tarp. So let's say you're a day late and a dollar short and you basically get a blister. So what are you going to do with that blister? Now there's all kinds of thoughts and comments on how to treat this blister. You'll see all kinds of ideas on YouTube, on different websites. So this is how I've done it, and I've really had good success with it. If you have a blister on the trail and the blister is intact, you're going to leave the roof of the blister on. So some people use a needle or a pin, and some use a tiny penknife. And at the base of the blister, you're going to run this in at the base of the blister, and then you're going to slowly squeeze and get the fluid out that you have. Now, you'll see blisters that are blood red. That's an indication that it's a deeper blister. You need to be really more prudent with those, more care. So, you're going to see people say, take your lighter and sterilize the pen. And then you get this carbon over the top of it from the butane. And you can wipe that off with an alcohol wipe. Does a lighter really help to sterilize it? 6 of one, half a dozen of the other. If you have the time and you stop on the trail and you're eating lunch, after you've cooked your meal and you got some water left over, run the water to a boil, drop your pin in there. The boiling water is going to be more effective than warming this little pin up with a butane lighter. In the long run, it's not going to matter a whole lot. I've really rarely seen these get infected. It's good to sterilize the top of the blister with an alcohol wipe, puncture the base, let the fluid run out. Then what you're going to do is you can do, if you carry Silvadene cream, it's an antibiotic cream. If you're allergic to sulfa, do not use this. Or bacitracin, which we talk about frequently. You're going to put a little dab of bacitracin. I like Adaptic. It will definitely not stick to the wound. It's a non-stick dressing. You use this for burns. Blisters are awesome. So you're going to lay a piece of this over the wound. You then can put a little bit of gauze over that. And we go back to our Coban or Medirip. This is the material that I've showed you in many of my videos, and it sticks to itself, and you can wrap it fairly tight. And that's how you're going to treat the blister on the trail. If the blister has unroofed and the top of it is completely gone, then you're going to do the same exact treatment, really no different, but you need to keep a guard on it, and you're going to look for any redness around the edges, or maybe the redness expands or it gets warm. If that happens, then you're starting to get an infection, and that's when you're going to need to seek medical care. So, what do I believe? Do I believe you should unroof blisters, leave the blister on? That's really the controversy. If you're on the trail, leave the blister on and remove the fluid like we just talked about. Once you get home and you're not going to go on any more hikes, then what's really helpful is that how I treat a blister, if it's not infected and you come into the clinic, I remove the top of the blister, I treat it with what I just explained to you guys, have them go home, washed with soap and water, cover it during the day, leave it open to air at night. All wounds need air to heal and it needs to dry out. In less than 72 hours, you're going to notice a vast improvement. If you get redness, if it gets hot, if you get drainage from that, then you're going to probably need an antibiotic. Diabetics, higher risk for infection if they get a blister, much higher risk, so be aware of that. If your feet do get wet on the trail, then it's really important that you change your socks. Because you can, I've only seen like 3 cases in 40 years, and they were homeless individuals who had trench foot, and that is a really bad condition. So, blister prevention, blister treatment, you got it. You got some questions you want to leave in the bottom, please leave them. Give me a thumbs up if you like the video. Keep your eyes on the horizon, your face to the wind. Stay safe, guys.